Hi everyone, this is Sean with the Western Mass team of the Mass Support Network, here with your COVID-19 update for Tuesday, September 29th, 2020. Looking at stats and trends across the world and here in the country. Worldwide, we've crossed 33 million cases, with about 2 million new cases in the last week, which is about the same, perhaps slightly more than what it was last week. In the US, we've had about 300,000 new cases in the last week, which is roughly on par, perhaps slightly less. And here in Massachusetts, we've seen about 4,000 new cases, which is an increase. Worldwide, when it comes to deaths, we have crossed 100 million, just following the US milestone of 200,000. While the US accounts for 4% of the world's population, we are over 20% of the COVID deaths in the world. Death rates are staying roughly on par, just under 40,000 worldwide per week, and about 5,000 per week in the US. Here in Massachusetts, we saw 98 deaths in the last week, which is about what it has been. So looking at the trends across the country from COVID tracking projects data, testing continues to increase, which is great. We're routinely putting out over 1 million tests a day. We are seeing a slight increase in cases from where we were last week following that dip, but the increased testing is helping out a lot with that. So unfortunately, it looks like hospitalizations after falling for a long time have plateaued, if not starting to trend upwards. Look at that more a little bit in a moment. And deaths are kind of level at the moment, perhaps slightly trending down. So in terms of cases, looking across the country in the different regions, this is cases adjusted by population, so the number of cases per million people. This kind of shows things a little more dramatically in smaller areas like the Midwest, which is the second smallest region in this area, but in the way these areas are broken up, but is showing the most dramatic rise right now, while the western part of the country may have a slight rise, perhaps leveling off, and the south is dropping down. The west is spiking a lot there. The northeast is showing a bit of a rise as well. Certainly nothing as dramatic there, but it is something that we need to keep our eyes on here. Also looking at hospitalizations, since that is plateauing or perhaps starting to rise, the south and west are continuing to decline. But the Midwest is showing a bit of a spike there. There's perhaps a slight rise as well in the Northeast, but the Midwest is accounting for that change in from cases falling to cases plateauing. So looking at new developments this week, obviously the biggest thing is that worldwide we have crossed 1 million deaths, which is a huge number, really kind of hard to get your head around. There are only 10 cities in the United States with more than 1 million people in them. The city of Boston plus Worcester plus Springfield is about 1 million people. 1 million is more than many island nations or European principalities. It's 3 times the population of Iceland. It's more than any other infectious disease. In fact, it's more than many infectious diseases have killed in the last year combined. So it's just a huge number there that it's kind of needs a moment to kind of process exactly how much that is and what the death toll has been worldwide. In more local news, the superintendent and medical director of the Holyoke Soldiers Home have been brought up on charges of neglect for the outbreaks and deaths there early in the pandemic. This is interesting as it will set a precedent, this kind of case, for any other future charges that might be brought upon areas with significant outbreaks or especially hard hit by the virus, if the leaders of institutions can be held accountable for the situations there. So that is the outcome of that case is something to watch as it shapes the response to the ongoing fallout from the pandemic. And a bit of science news, there's a new theory on children's response to COVID. Why it's generally better is that children have a stronger innate immunity or innate immune system. The immune system is divided in two parts generally, the innate immunity and adaptive. Innate is the first line of defense. It will fight against anything that it doesn't recognize and has sort of generalized responses, whereas the adaptive immune system is specialized. It's the part that creates antibodies that target specific pathogens. And since children have a fairly weak adaptive immune system because they haven't had the time to learn against multiple different types of diseases, their innate immune system is stronger. And it's possible that's what's making children have less reactions, that the innate immune system is actually does more against COVID, whereas the time it takes for the adaptive immune system to catch up adds a lot of danger there for adults. We have weaker innate immune systems because we have a more trained and practiced adaptive immune system. Checking in with vaccines, not a lot of changes here. The only one note is there's one fewer project listed phase 2 there. It's probably due to the Inovio vaccine project paused their trials with some FDA questions on their program, but they're still going on in phase 1, and we'll start restarting at phase 2, 3 shortly once that gets straightened out. But the phase 3 projects are still ongoing there. All right, you can find our data here. And for more from the Mass Support Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.